I wake up to the sound of my alarm at 6 a.m., although most mornings I'm already halfway awake, thinking about the day ahead. Coffee is my lifeline, strong and black. I stare at my reflection, wondering how my smile, the one I help everyone else perfect, somehow looks tired and strained today. My mornings are quiet, a calm before the storm. I glance at my schedule on my phone. 10 patients before lunch, sometimes 12. It never seems to end. I drive to the clinic, and I pass other people on their way to work, smiling, chatting, not knowing what lies ahead. I used to envy them. Now, I just focus on the music in the car and try not to think about the first patient, because I know it's going to be someone who hasn't flossed in months. I unlock the doors, and the clinic smells like antiseptic and toothpaste. It's a strange, sterile smell that I've grown to love and hate at the same time. I check the waiting room. It's already filling up. Parents with kids, nervous adults, a teenager wearing headphones, looking at their phone like they're in a different world. The first patient is an older man. He sits down and immediately starts complaining about pain. I ask him to open his mouth, and immediately I see the problem. A massive cavity, inflamed gums. I brace myself for the usual questions. Is it going to hurt? Can't we just wait? Do I really need that root canal? I smile, the professional smile that hides the exhaustion I feel inside, and I explain. He sighs, resigned. I know he hates this, just like I do sometimes, even as a dentist. By mid-morning, the stress starts creeping in. My hands ache from holding instruments. My back stiffens from leaning over patients. I try to smile, make jokes, keep things light, but sometimes the humor falls flat. People are scared. Adults are scared. Kids are terrified. Even the thought of a simple cleaning can reduce someone to tears. And it's my job to make it seem normal. A little girl comes in next. She's 5. Her mother tells me she's afraid of needles. I kneel down, try to make her giggle. I use the silly suction tool and pretend it's a little vacuum monster. She laughs. And for a moment, I feel a warmth I don't often get in this job. But then she screams when I need to give the anesthetic. I freeze. Just for a second. I hate causing pain. We all do. But it's necessary. I apologize as she cries, and the mother gives me a look that says, "I'm sorry, but you better fix this." I nod. I bite my lip. The emotional labor is real. By late morning, I'm running behind. A teenager needs braces consultation. A middle-aged woman has a tooth extraction, and the phone keeps ringing. Insurance questions, scheduling conflicts, emergencies. I used to think dentistry was all about teeth, but it's mostly about paperwork, billing, and managing people's unrealistic expectations. Some patients want a perfect smile overnight. Some think flossing once in a while is enough. Some don't even show up and expect us to magically find time for them later. I steal a moment to sip coffee. It's lukewarm now, bitter, but it's better than nothing. I glance at the clock. Another patient is waiting. I wash my hands for the 5th time in 30 minutes. Gloves, mask, apron, goggles, like armor for a battle I fight every day. And that's exactly what it feels like sometimes. A battle between decay and care, between pain and patience, between my own fatigue and everyone else's expectations. One patient comes in complaining about sensitivity. I examine him, and the truth is brutal. He hasn't brushed properly in years. I explain gently but firmly. People don't like hearing that. He frowns. I see anger, embarrassment. I understand. We all know the habits we should change but avoid. I wish I could do more than give advice. Sometimes I feel like I'm just a messenger of bad news. Lunch is a blur. Usually, it's a granola bar shoved into my mouth while I chart notes from the morning. Rarely do I get to sit down. My colleagues tell me to take breaks, but the thought of leaving patients waiting makes me anxious. The truth is, I love the work. I love helping people. I hate the logistics, the stress, the constant pressure to be perfect while everyone else is terrified of me. Afternoon hits. I get emergency calls. A man with a cracked tooth is sobbing. I set him up in the chair, numb the area, and do what I can. His relief is immediate. I feel satisfaction, fleeting though it is, the rush of fixing something broken, helping someone in pain. That's what keeps me going, but it's exhausting. I'm constantly switching between roles: doctor, counselor, teacher, sometimes magician. A teenager comes in after a sports injury, broken front tooth, blood, panic. I calm him down, reassure him, and start the repair. Kids are resilient in ways adults aren't. They trust you quickly, then forget the pain almost immediately. Adults carry guilt, anxiety, and memories. Sometimes it's harder to work on them. I glance at the clock. It's late. My body aches. My feet hurt. I can feel the tension in my neck. But I still have 3 more patients before the day ends. Each patient carries their own story. Each story comes with expectations, fears, sometimes irrational demands. And I have to handle it all. Smile plastered on my face, hands steady, voice calm. A mother brings her son for a routine checkup. He's scared but curious. I take time to explain every tool, every sound. We make jokes about the little mirrors and the suction tool. For a moment, it feels human, warm, not clinical. And then he opens his mouth, and I notice decay I didn't expect. I suppress a sigh. I know the work ahead will be uncomfortable for him. For me, too. By evening, the appointments slow down. The last patient is a woman who hasn't seen a dentist in 5 years. She apologizes before I even start, embarrassed. I tell her it's okay. We start slowly, assessing the damage. There's a lot of work to do. I'm tired, my hands sore, my patience tested. I remind myself why I do this. Because despite all the stress, the hidden truths, the awkward moments, I make people feel better. I prevent pain. I restore health. After she leaves, I clean up, sanitize every instrument, every chair. I check my schedule for tomorrow, already worrying. Some days feel endless, repetitive, thankless. Other days feel rewarding, fulfilling, even joyful in small, hidden ways. I lock up the clinic, step outside, and take a deep breath. The sun is setting. I can feel the tension in my shoulders start to ease, replaced with exhaustion. Driving home, I think about the day, the pain I witnessed, the relief I provided, the moments of laughter, the cries, the tiny victories. Dentistry is a strange profession. People admire from the outside, but they don't see the strain, the emotional weight, the back pain, the stress, the constant vigilance. I get home, remove my mask, wash my hands, and finally sit. My own mouth is aching from clenching my teeth through the day. I eat something simple, sip water, scroll through messages, family updates, a few texts from colleagues sharing the day's ridiculous stories. Humor is our coping mechanism. Without it, this job would break us. I reflect on my patients. Some I'll see again soon. Some I'll never see. Some made me laugh. Some made me cry. And I think about why I keep doing this. Because behind the stress, the challenges, the hidden truths, there's purpose. There's meaning. I help people in ways most of the world never truly understands. I face fear every day, not my own, but theirs. And I'm tired, yes, bone-deep tired, but I'm also proud. Quietly proud. Before bed, I brush my teeth slowly, thinking about all the teeth I brushed, fixed, extracted, saved, and yes, even failed to save today. I floss, careful, methodical, like a ritual. Sometimes I think about quitting. Other times, I think about how much worse it would be without someone to do this work, to guide people, to prevent pain, to face discomfort head-on. I set my alarm for tomorrow, knowing the cycle will repeat. I close my eyes. My back still aches. My hands still tingle. My mind is full of tiny worries, stories, and reminders. But sleep comes anyway, and with it, a brief respite. And tomorrow, I'll wake up and do it all over again. Because this is what it means to be a dentist. And for all its challenges, for all its hidden truths and human moments, it's the life I chose, and somehow, in a strange way, it's one that matters.